So in this picture you are seeing this is the lateral plate of pterygoid process, and just at the base you are seeing the one oval foramina. This foramina is known as foramen ovale. Just posterior to this foramen ovale you are seeing one small foramina. This is known as foramen spinosum. The name foramen spinosum is given because of that this foramina is present just anterior to the spine of sphenoid bone. You are seeing here this is a spine of sphenoid bone, and this foramina is present just anterior to the spine of sphenoid bone. So how you recognize this foramen ovale present just at the base of the lateral pterygoid plate of sphenoid bone. This. Now these two foramina are present in the infratemporal surface of greater wing of sphenoid bone. So greater wing of sphenoid bone having temporal surface, you are seeing the temporal surface, and this is infratemporal surface. These two surfaces are divided by infratemporal crest. This is infratemporal crest of sphenoid bone. So infratemporal surface of sphenoid bone having anterior margin, and this is anterolateral margin, which forming the infratemporal crest, and this is posterolateral margin, which articulates with the saphenous part of temporal bone, and this is posteromedian margin, which articulates with the petrous part of temporal bone. This is posteromedian margin, this is posterolateral margin, and these two foramina are present in the greater wing of sphenoid bone. Now here you are seeing the mandibular fossa, which joins with the head of the mandible and forms the temporomandibular joint. Just this fossa is bounded entirely by the articular cartilage. This elevation is known as anterior tubercle, and I have told already that the tubercle of the root of zygoma divides into the two parts, anterior part and lateral part. The anterior part forms the anterior boundary of mandibular fossa, which is known as articular tubercle, and the posterior part forms the lateral boundary of the mandibular fossa. This is mandibular fossa. Just behind the mandibular fossa you are seeing the one fissure here between the this is tympanic part. This is external auditory meatus. What you are seeing external auditory meatus here, and this is tympanic plate of temporal bone, and this is squamous part of temporal bone. So between these two bones there is a fissure. This fissure is known as squamotympanic fissure. This squamotympanic fissure is divided by a perpendicular plate of tegment tympani bone. I will discuss it later, but just see here there is a bone you are seeing between these two fissures, which divides the squamotympanic fissure into two parts, petrosquamous part and petrotympanic part. No structure passes through the petrosquamous part, but through the petrotympanic part, chorda tympani nerve coming out, which is the branch of the facial nerve, and anterior tympanic artery goes into the middle ear cavity through this fissure. So this is all about this squamotympanic fissure, and just you go medially you are seeing that there is a groove present between the posteromedial margin of the greater wing of sphenoid bone and petrous part of temporal bone. This is petrous part of temporal bone. This sulcus is known as sulcus tubi. In sulcus tubis, cartilaginous part of auditory tube or eustachian tube lies in this sulcus. So it is known as sulcus tubi. Cartilaginous part of eustachian tube lies in this sulcus. This is very important point. You have to remember this. Now you are seeing the petrous part, inferior surface of the petrous part of temporal bone, and in inferior surface you are seeing the carotid canal, which opens into the apex of the petrous part of temporal bone, and between there is a gap between apex of the petrous part of temporal bone and sphenoid bone, body of sphenoid bone. This is known as foramen lacerum. There is a foramen present in the anterior wall of the foramen lacerum in the sphenoid bone. This foramen leads into canal. This canal is known as pterygoid canal. So pterygoid canal is present in the sphenoid bone, just in the anterior wall of foramen lacerum. So these canals again open into the pterygopalatine fossa. So we will discuss about this canal later, and this is very important canal. Pterygoid canal is very important canal, and it opens into the pterygopalatine fossa. So finally this is a spine of sphenoid bone, and this is all about the middle part. Okay, one thing I have left here, this median part, you are seeing the bar of bone in the median region. This bar of bone is formed by the by fusion of the body of sphenoid bone. This is the sphenoid bone, this is body of sphenoid bone, and the basilar part of the occipital bone. So these two parts fuse and form this bar of bone. So this picture showing the structure passing through the various foramens. So this is foramen ovale, and you are seeing the mandibular nerve is the branch of trigeminal nerve is coming out through foramen ovale, and accessory meningeal artery. Accessory meningeal artery is a branch of maxillary artery is going into the cranial cavity through this foramen, and also you are seeing one nerve, lesser petrosal nerve, is also coming out through this foramen, and emissary vein also. These are connecting veins between the cavernous sinus and the plexus of vein present in the base of the skull. So these are the structure passing through the foramen ovale, and now you are seeing this is foramen spinosum. So middle meningeal artery, which is the branch of the maxillary artery, is going into the cranial cavity through this foramen and supplies the meninges, and also mandibular nerve gives one branch. This is the meningeal branch, which goes into the cranial cavity through this foramen spinosum, and this meningeal branch of mandibular is also known as nervus spinosus. Beside these two foramens, one canal, sometimes there is a canal present between foramen ovale and foramen spinosum. This canal is known as canalicus innominatus. When lesser petrosal nerve not passing through this foramen ovale, then this lateral petrosal nerve pass through canalicus innominatus, and the second foramen which is also sometimes present just medial to the foramen ovale. This is known as emissary sphenoidal foramen. So emissary veins passes through this foramen. So beside these two foramens, we can also get these two foramens. So this is all of structures present in the middle part of the Norma basalis.